Luigi.
Recording in progress.
Panelists, and then we will open things up to a media Q&A at the end of the presentation. A couple of housekeeping notes ahead of time here. We do have a pair of interpretation options available to anybody listening here. We have an American Sign Language interpretation channel, as well as a Spanish interpretation channel. And if you're looking to customize that view on your screen a little bit, you can use that gray slider bar, and you can kind of go back and forth between the presenters and the presentation, the slides that way. So without further ado, our participants for today, Scott Bookman, our COVID-19 incident commander, and Dr. Rachel Herlihy, state epidemiologist. And Dr. Herlihy, I'll send it over to you.
Great, thank you so much. Good afternoon, and thank you all for being here. So starting here where we normally do with an update on our case counts in the state. So this is the figure that shows you our daily case counts with each of those gray vertical bars, and our 7-day moving average trend with the red line in this figure. So what you'll see if you look at the far right end of this figure is that unfortunately, after many weeks now of a declining trend in cases, we are now seeing a reversal of that trend. We are now seeing an increase in the number of cases that are occurring in the state. So we know that that increase is pretty variable when you look across the state right now. So we have some counties where we are not yet seeing an increase in cases. We have other counties, some of our mountain resort communities, Denver County also, where we are seeing pretty rapid increases in the number of cases now. And we do believe that this is being caused by the Omicron variant. So again, unfortunately, seeing that first sign in our case data of increasing number of cases here in Colorado, likely being driven by the Omicron variant. Next slide, please. We see a very similar trend in our percent positivity data. As I've explained previously, this data, the percent positivity data, is often a little bit ahead of our case data. So you can see a little bit longer of an increasing trend here when you look at our percent positivity data. So again, after several weeks of decreasing percent positivity in the state for the last few days now, we are unfortunately seeing an increasing percent positivity trend, again, likely associated with the increase in the Omicron variant here in the state. Next slide, please. All right, just a couple of updates on the Omicron variant. So as time goes on, we are learning more and more about this variant, though there's obviously still much for us to learn. But it is becoming clear by the data that is available from South Africa and some European countries primarily that the Omicron variant does appear to have increased transmissibility when compared to the Delta variant and earlier variants in the original lineage of the SARS-CoV-2 virus. And we are seeing that play out with the really rapid case increases that are occurring across the globe right now, including, unfortunately, in the last few days here in Colorado. One data point that also points to this virus being more transmissible is data that we have on risk of becoming a case or close contacts of cases. And it does look like the odds of becoming a close contact becoming a case is about double for Omicron than it is for Delta. So again, increased risk of becoming a case for those that have close contact to a known case. And of course, we know that the risk of becoming a case continues to be highest among individuals that are unvaccinated. We are seeing increased risk of reinfection and increased vaccine breakthrough infections occurring with the Omicron variant. But it does look like there are higher levels of protection against severe disease. So while we are seeing vaccine breakthrough infections, those infections are going to be more common than vaccine breakthrough severe disease. So again, we believe that the vaccine, even 2 doses of the vaccine, is probably offering some level of protection against severe disease and prevention of hospitalization. But of course, the greatest protection will come from receiving that third mRNA dose, or that booster dose of vaccine, is really what is going to offer the greatest level of protection, both against infection and against severe disease. So now more than ever, booster doses or third doses of vaccine are incredibly important. The data continue to be pretty mixed on severity. There was some early reassuring data coming out of South Africa that severity and rates of hospitalization perhaps looked lower than earlier phases of the pandemic. The data has been a little less reassuring out of some European countries. And so again, a pretty variable picture on what severity might look like. But a lot of the messaging that we're hearing from other countries and from our federal partners is that even if we do see less severity, the increased number of cases that may potentially occur as we see Omicron emerge across the US may be enough to increase hospitalization rates substantially. Here in Colorado, we have now identified the key signature mutations of the Omicron variant in all 21 of our wastewater systems that are participating in our detection system. So at this point, we do believe that Omicron is widespread across the state, and there is likely local transmission occurring in many of our communities, if not most of our communities now. Next slide, please. All right, I want to provide you with this new data. So this is not data we've previously shared. So this is data coming from our state laboratory. This figure is showing you of the PCR tests that are being done at our state lab and are coming back positive, what proportion of them show the signature PCR test profile that is associated with the Omicron variant. And that is called S-gene target failure, or SGTF, as shown in this figure. So S-gene target failure is that signature profile that the Omicron variant has when you do a PCR test with a specific type of PCR. This is the same profile that we saw with the Alpha variant a year ago, it's a profile that we did not see with the Delta variant, but it is emerging again and is associated with the Omicron variant. And so what this figure is showing you is, with the green vertical bars, is the number of positive PCR tests that have been identified in our laboratory. And then the blue line is showing you what percentage of those PCR tests have that Omicron signature S-gene target failure profile. And so you see that there is a background rate of that S-gene target failure profile that we've seen for many weeks now, including throughout November and early into December. You can see that there's a really rapid increase in the proportion of those PCR positive tests that are identified as S-gene target failure starting in about mid-December. And you can see even just the last few days, we've seen a really rapid increase. And so at this point, we are now in our state lab seeing about 45%, probably just below 50% of the PCR specimens that are being tested there do have this S-gene target failure associated with Omicron. So we could infer from this that potentially half of what we're seeing in the state, at least as of a couple of days ago, was potentially or is potentially the Omicron variant. And with that, I will hand it over to Director Bookman.
Thank you, Dr. Harlehy, and thanks to everybody for joining us today. Just two quick slides here on the status of hospitalizations and hospital beds in Colorado as of today. You can see on the right here, we are seeing a pretty significant decline in COVID hospitalizations over the last several days and weeks. While our peak of over 1,500 people being hospitalized with COVID in December was not as high as our peak last December, we certainly got to a point where our healthcare system was significantly stressed. We have seen a pretty significant decrease in hospitalizations. We're now down to 1,026 people hospitalized with COVID today. We're really grateful that we're seeing this as we prepare for what may be coming with Omicron. So on the next slide, I will show what I think is now becoming a relatively familiar figure that we use in these briefings. Again, to orient everyone, the blue bars are daily COVID hospitalizations. The orange line shows the number of acute care beds available on a 7-day moving average. You'll see as of today, we have our 7-day moving average is 631 acute care beds available. You can see that is moving on the right upward trajectory there. More beds available than we had yesterday and the day before. So we do have increasing capacity as more and more people with COVID are being discharged from the hospitals. And our teams have been doing an enormous amount of work to add hospital capacity over the last few weeks. And that capacity will become even more important as we prepare for this Omicron surge that we are concerned about. Next slide. Brian, back to you.
Thank you, Director Bookman and Dr. Herlihy. We'll go ahead and open things up for the media Q&A portion of this afternoon's press conference. A couple of notes here. Let's use the raise hand function. You can find that option at the bottom of your Zoom console, and we'll go ahead and go through as those hands are raised. Let's start with first questions first. If we do have time for second questions or follow-ups, we can certainly come back to those after we've gotten through our first questions. Please do state your name and outlet before asking your question. And if there's any questions that you're unable to get answered today or that maybe were not covered in today's press conference, feel free to email us at media_info@state.co.us. Let's go ahead and start with KDVR.
Good afternoon. This is Alex Rose with Fox 31. I'm just curious, today the FDA granted emergency use authorization for Pfizer's COVID pill. When can Coloradans expect to see that product, say in pharmacy shelves or in our hospitals around the state? Thank you.
Alex, obviously very exciting news as we are preparing to receive another tool in the toolbox to fight COVID. That announcement was made earlier today. We have incredibly limited information. We do expect that there's going to be a very limited supply coming to the state when this does become available initially. But we will get more information from our federal partners in the coming days about what will be available. And as soon as we have that information, we'll share.
Let's go ahead to Jason Grunauer.
Yes, I was just curious where we're standing when terms of hospitalizations is a lot better than we have been over the last few weeks. Given that, are we in a better place now with the expected rise in Omicron cases as families get ready to gather for the holidays? And just a part B to that, given the fact that Omicron cases are expected to rise, how do you balance that with this less reporting and less testing that we had talked about a couple of weeks ago on this Zoom, this under-reporting and expected drop in cases?
So why don't I take the first part of that and maybe the second part of it. But I want to start with acknowledging how tired our healthcare workers are and that they are 22 months into an almost constant wave of COVID patients. And while COVID hospitalizations are going down and there is a little bit more bed capacity available, we all continue to owe a huge amount of gratitude for our healthcare workers and our first responders on the front lines who are taking care of these patients. There are still 1,000 people hospitalized with COVID today. That is a lot of additional patients in there. And while we do see a bit of breathing room there, as Dr. Herlihy indicated, that there's a lot of concern nationally and internationally that just the sheer transmissibility of this variant may result in an increase in hospitalizations again.
All right, so as far as case reporting and case investigation over the holidays, so we know that there are a variety of things that can lead to fewer cases being reported or delays in cases being reported over the holidays. And some of that is individuals not necessarily seeking testing over the holidays. And so I think my first message there is that testing is obviously a really important strategy for situational awareness, for us having awareness of how much transmission is occurring in the state. And then also for individuals, awareness of whether or not the symptoms they're having or even if they're not having symptoms, but they've had an exposure, if they may be infected, that knowledge is what's obviously really important for preventing that next generation of cases from occurring. So certainly continue to encourage Coloradans to seek testing, even over the holidays, if you have an exposure or if you develop symptoms. There are going to continue to be testing sites available for testing, and we can get to the specifics on availability of those testing sites over the holidays to ensure that Coloradans have the access that they need over the holidays.
All right, let's go to David Perry. Go ahead, David.
Hi there, Dave Perry with Sentinel, Colorado. My question is about schools and pediatrics, and I wondered if there's any information available regarding the new variant and how it affects pediatric cases. And also, it looks like if Colorado follows the trajectory that other cities have with a compounding effect, like every day and a half, by the time school starts again, this will almost certainly be the dominant variant, at least in some parts of the state. And if so, does the Department of Health look at intervening as far as new prevention measures inside of schools, especially school districts that have, for one reason or another, prevented people from having a mask mandate or interceded in that way?
So I can start with our knowledge and what we know so far about how Omicron is impacting children. So what we know is true for both adults and children is that Omicron appears to be more transmissible and so more easily spread from person to person. As I mentioned a few minutes ago, the data are really still out on what severity looks like for Omicron. We've seen mixed data. There is some very limited data out of South Africa that did look at severity and risk of hospitalization in adults versus children. That data out of South Africa identified a decreased risk of hospitalization for adults in South Africa associated with Omicron, but actually an increased risk of hospitalization for children. Again, very limited data, very small numbers, and I don't think we're able to make any firm conclusions yet about severity in children who are infected with Omicron, but we certainly do expect the increased transmissibility that we are seeing in general with Omicron to hold true in transmission in children.
That affect a decision by the Department of Health to recommend like mask mandates in schools if this is the dominant variant and it's so transmissible again next year?
Yeah, so all of the strategies that we've been using to limit transmission in schools will continue to be really important and more important than ever with the Omicron variant. So that obviously includes the use of masks in schools, which we strongly recommend in our school guidance. Obviously, the best strategy is going to be vaccination of individuals. We also have guidance on ventilation and social distancing, other physical distancing, other things that can be done to really try and make our schools as safe as possible for our children.
All right, let's go to Erica Meltzer. Go ahead, Erica.
I was curious if you're considering any changes to the quarantine policy, either in light of the increased transmissibility to maybe do more quarantines or to look at the test to stay recommendations so that this larger number of cases is that we would be expecting would be less disruptive.
So we are looking to federal guidance. We know that the UK has recently updated guidance there on isolation. So individuals that test positive, isolation standards for individuals, given concerns about worker shortages, specifically in healthcare workers. So we're looking to the federal government here in the US for potential guidance on that. Test to stay and testing strategies in schools are obviously a critical component of keeping kids in schools and keeping schools a safe environment. And so we continue to explore options and are looking at broadening our testing capacity for our schools.
All right, let's go to Vinny. Go ahead, Vinny.
Good afternoon. This is Vinny Deljudice at Bloomberg News in Denver. Regarding Omicron in the resort areas, Eagle County has put in place some mandatory indoor mask order today. Overall, are you suspecting that people are bringing this in, skiers are bringing it in from perhaps the East or other parts of the world? Thank you very much.
So our contact tracing data in the state did indicate that early on, many of our cases, as you would expect, were cases that were imported into the state, either from other states or from South Africa or other countries. And so we know that's how Omicron likely first arrived in Colorado and various parts of the state. But at this point, we believe there's local transmission occurring in many of our communities that is no longer travel associated. So we believe that Omicron is being transmitted from person to person pretty readily in Colorado right now.
All right, let's go to Seth.
Hey guys, Seth from the Gazette. So obviously we're a few days from Christmas, a little further out from New Year's. What impact do you anticipate those holidays having on Omicron spread? And what's your level of concern given our proximity to those holidays? Thanks.
Given our experience and what we are observing in other states and other countries right now, this very recent increase that we've seen in percent positivity in cases does suggest to me that we will continue to see an increase in cases and percent positivity in the next coming days, weeks, potentially, and also anticipate that we could see an increase in hospitalizations starting in the next couple of days as well, if the trends that we've seen with previous waves hold true for this wave. Obviously, lots we still need to learn. And so as individuals are planning for their holiday get-togethers, keeping in mind all of the guidance that we've been sharing for almost 2 years now is really important. We know that testing is a really important strategy. So there's recommendations from the federal government to have individuals test before gathering. Certainly gatherings that are limited to individuals that are vaccinated, or ideally folks that have received booster doses, are a good idea. Physical distancing, having events outdoors, at least in the metro area, it looks like the weather's going to be quite nice. That's a great risk reduction strategy. So all of the things that we've been doing to make gatherings safer will be really important this holiday.
I want to see if there are any other first questions in the room today. All right, Chelsea, go ahead.
As people are preparing to travel, are there any testing recommendations that you have for folks? I know that the state's expanded testing, but are there any testing recommendations for travel that you have for Coloradans who are maybe leaving out of state?
Yes, so the testing guidance right now after travel is primarily related to international travel. So the guidance there is to be tested 5 to 7 days after traveling. But we also recognize that if individuals are concerned they've had an exposure, it is a good idea to have testing done. And so would encourage individuals who are concerned they may have been exposed to COVID-19 to seek testing.
All right, any other first questions? All right, then we can go back to KDVR.
Hi, it's Alex Rose again with Fox 31. One of the things looking at the data that really jumps out to me is the fact that we have 500 less people hospitalized for COVID-19 today than we did a month ago, which was our peak, late December, right? But we're still dealing with really tight margins for ICU beds. 94% of ICU beds in the state are currently being used, despite that decrease in hospitalizations. What's driving this? And I know that the governor put in some action to try to increase that capacity. Did that have any impact on this? Because it doesn't look like it has.
So, what we have been hearing from our hospitals is that, there are pretty significant impacts of people who have been delaying care or who have had delayed care because of the, pandemic. And so early on, people were not going to see their primary care physician. They were not getting normal screening. At some of our peaks, we know we've had limited capacity. And so surgeries have been postponed and delayed. And so, anytime that beds open up, we continue to see our hospitals working to catch up. And so the impact of that delayed care is going to be with us for some time. We continue to work with our hospitals. We're adding beds, with our federal teams, with our contracts. We've added beds at nursing homes so that people can be transferred out of hospitals into their long-term care environment, all to continue increasing our capacity.
All right, let's go back to Erica.
When we look at what's happening on the East Coast, we're seeing these nearly vertical lines. Is there any reason to hope that the impact here would be a little bit blunted because we're coming off of this pretty sustained Delta wave, or just no way to know?
Yeah, I think that's a great question. I share your hope, but I don't know how likely it is. Unfortunately, I don't think we know enough about the Omicron variant to know if states like Colorado, who are just coming off of a large wave, might be in a different position than a state like Florida, who's coming off of a low number of cases and hospitalizations. So, I think at this point we are starting to see some pretty rapid increases in cases already in the state. As I mentioned, some of our mountain resort communities are seeing that pretty rapid increase right now. We're also, I think, just in the last couple of days, starting to see an increase in Denver. So I think it is quite possible that we are going to follow the trends that we've been seeing in some large cities on the East Coast and states on the East Coast, with the trends that we might see here in Colorado in the next couple of days.
And let's go back to Dave Perry.
Hi, it's Dave Perry with the Sentinel again. My question is about the ability to forecast hospital bed availability. And it seems that from the information you've given us before that the state has become pretty adept at looking at like a rate of positivity from Delta variant patients and what that translates into how many people are generally hospitalized based on that positivity. And I wonder, since you're sounding the alarm saying that this looks really scary because the rate of positivity could go up substantially as infections increase rapidly, is there a sense of when those two ill numbers might meet, what the availability for beds is based on what rate of positivity with the new variant, or is it too early to tell?
So we are at a really challenging time in trying to forecast COVID-19 transmission and hospitalizations because we don't have great data on severity right now. So as I mentioned at the beginning of the presentation today, the data are kind of all over the place right now with what severity looks like. We have South Africa that's offering a more reassuring picture and less severity, but we don't see the same thing necessarily coming out of estimates from European countries. And so unfortunately, that's sort of a key data point that we need to be able to precisely estimate what hospitalizations could look like in the next couple of weeks. And unfortunately, we just don't have the data there, the estimates there, or know how to apply them specifically to Colorado's situation to be able to, predict with confidence what hospitalization numbers might look like.
All right. Thank you, everyone, for joining us today. This is going to wrap up today's press conference. If you have any questions that we were not able to get to today or that were not answered in the media avail, please email us at media_info@state.co.us, and we'll get you some information as soon as we can. Again, thank you for joining today and have a good rest of your afternoon.